corner, but when it comes to respiratory virus season, we're not out of the woods yet. Nationwide, we're seeing a high number of emergency room visits for the flu, and COVID cases are high in several states according to the CDC. Now, here to talk about who's at risk and how to keep healthy is Amish Aldalja, Pittsburgh-based infectious disease physician. Good morning. How are you?
Good morning. I'm well. Thanks for having me.
Thank you for joining us. So, doctor, can you explain the peak season for respiratory illnesses and what that means to Americans?
The peak season of respiratory illnesses usually begin in late fall and end in late spring. And what that means is that there are probably a dozen or so different respiratory viruses circulating, infecting people, including what I call the big three: influenza, RSV, and since 2020, COVID-19. And COVID also has this summer surge as well. So we have kind of two peaks with COVID-19. But during the respiratory virus season, people really need to think about, are they optimally protected? Are they using all the tools that are out there?
You know, doctor, should people still be concerned about getting COVID-19 this season?
Definitely. COVID-19 is what we would call an endemic respiratory virus. It's something that we will see year in and year out, basically from now until forever. And there are, if you look back at 2024, for example, we had 47,000 people die. That's more or around the same number of people that died during the Vietnam War from automobile crashes every year. That's one every 11 minutes, hundreds of thousands of hospitalizations. So this is still a very disruptive factor in our lives, and it is something for which we have a lot of tools that people need to make sure they're actually optimally using. They're not sitting on shelves.
Now, who are the most vulnerable to respiratory illnesses?
So respiratory viruses tend to hit people the hardest that have underlying conditions. So that could be people that are elderly, people that are overweight, obese, pregnant, heart and lung disease, immunocompromised. And remember, there's probably about 10 million people in the United States that are immunocompromised. With influenza, we also would add children as a high-risk group. And with RSV, it's the very old and the very young. RSV is the most common cause of infant hospitalization.
Now, what should people do to help prevent getting these viruses, particularly COVID?
So there are many tools that science and medicine have developed that we have to take advantage of. So with RSV, we have monoclonal antibodies for neonates. We have vaccines for pregnant women to protect neonates. We have vaccines for elderly. For influenza, we've got home tests. We have antivirals. We have vaccines. And for COVID, we probably have more tools than any other respiratory virus. So that includes home tests, antivirals, vaccines, and for those immunocompromised people who don't respond well to the vaccine or don't get full protection from the vaccine, we have monoclonal antibodies. The key thing is that people need to be aware of these tools. They need to talk to their providers about them, and we need to get them off the shelves into people where they can actually do benefit and actually keep people out of the hospital, keep people from dying.
All right, doctor, now where can people learn more? Where can we go?
So I partnered with Invivid to really increase people's awareness about respiratory virus season, the tools that are available for them. And there's a website called expandtheiroptions.com where people can peruse the information and take that to their provider and see how it might apply to them.
Dr. Aldalja, thank you so much for joining us on Morning Blend. I really appreciate it. You're a senior scholar at Johns Hopkins Center for Health Security, adjunct assistant professor at Johns Hopkins Bloomberg School of Public Health, and affiliate of the Johns Hopkins Center for Global Health. Thank you again so much for joining us on Morning Blend with this very helpful information.